Hello and welcome to Opt to Thrive, episode 55. When you're told you're fat and lazy, but it's actually lipedema. This is Chantel's story.
Welcome to Opt to Thrive, your go-to podcast for women's wellness in midlife, designed to educate, support, and inspire you to live your very best life. And now your host, Dr. Karina Sims.
Today we're going to talk about a not very well-known condition called lipedema. I talked about it a few episodes ago, and I mentioned on that episode that I had a very special guest who has agreed to come and talk to us a little bit more about it, and in particular, give us her story, because as I said, this condition is not well known, and even though it affects mainly women, and it usually shows up around puberty, the diagnosis doesn't often get made until a woman is in her 30s or even her 40s. So the formal definition of lipedema or lipedema, you'll hear it said both ways. The formal definition of lipedema is a chronic progressive adipose tissue, so fat tissue disorder, characterized by symmetrical, so both sides of the body, disproportionate accumulation of subcutaneous fat in the lower extremities. So the buttocks, the thighs, the legs, and sometimes it affects the arms, but it always spares the hands and the feet. So today's guest is committed to bringing more awareness to help others who may be suffering from this condition but haven't quite yet put a name to it maybe, to help empower them to take this information and work towards getting a formal diagnosis and then being able to get some treatment earlier than they would have not knowing this information. And also, we want to bring awareness to help those who don't suffer from this condition develop a better understanding, because there can be some judgments made for women who suffer from this condition. Often people, and maybe even some doctors, tell them that they should just lose some weight, for instance. And we know that that's not helpful, and we're going to break that down for you today. So today's very special guest is a health professional herself. She's a registered nurse who now works directly with people who suffer from this condition and other conditions that have some similarities. And we'll hopefully talk a little bit more about that today as well. So welcome to the show, Chantel. So I've already done an introduction, and I am just so grateful for you to take your time to share your story with us today. So I really want to, actually, I might just stop there and welcome you to the show.
Thank you. Thanks for having me.
Now, in my previous podcast, I talked a little bit about what lipedema is, and I am so interested to hear from both your personal and your professional experience, you know, how you explain it. Can you explain it for those who may have never heard of it before?
Oh, gosh, right. I've always understood it that ultimately your fat cells become inflamed. And with the inflammation in general in any part of your body, it attracts proteins and fluids and things, and then you get the swelling on top of it. Okay. If it's left untreated, you then have the encroachment on your lymphatic system, so you can get secondary lymphedema. Okay. So you have lipolymphedema. Yes.
Okay.
Does that answer your question?
Yeah, absolutely. Yeah. So I really want, you have such an interesting story. I really want to dive into your journey, because I find it really fascinating, and I guess part of that is feeling so bad for the patients that I have misdiagnosed along the way. So let's go back right to the beginning. When did you first have an idea that something wasn't quite, I guess, I don't want to say normal, but you know.
Yeah. Probably in puberty. So your body changes anyway, right? And anything can be attributed to puberty. This happens, it's puberty. But I had changes that no one else was having, and it didn't make sense with my lifestyle or any of those sorts of things. But I was just told, you need to eat better and not let yourself go. All those sorts of things that are really unhelpful in hindsight.
Yeah.
And I think for me, a big difference that I was noticing between myself and my peers were that some of my peers were bigger than me, but they still had shape in their legs, and I just had these columns. Yeah. So it was just abnormal changes, and that didn't make sense. So that happened in puberty, but then each sort of pregnancy with the hormonal changes, then I had even more changes. That, again, you could say, well, it's just pregnancy, it's water, you're carrying fluid, all that sort of stuff, which didn't explain the extra symptoms that I had around pain and tenderness and heaviness and feeling like I had a heartbeat in my ankles. But yeah, probably, and they say with lipedema, the key changes that you'll see happen during puberty, pregnancies and menopause. So from my experience, that rings true.
Yeah. Okay. So from my reading, it sounds like they think it might be an autosomal dominant condition, and so that 50% of offspring would theoretically have it. So looking back, can you see that anyone in your family had it?
I think probably on my dad's side, yeah. Okay. My grandma and my auntie probably did. Yeah.
Okay. Well, that's interesting because I know also that it primarily affects women, and so then if you don't have it to give, you generally can't pass it on. I'm going way back to genetics here, but so if you got it from your dad's side, I wonder, because men don't get it, if they can be a carrier. That's interesting. I mean,
apparently they say that men can get it. There's an understanding.
Really rare.
Yeah, correct. A significantly disproportion. Very much less men will get it than women. But yeah, I mean, on my mum's side, there were things like thicker ankles, for use of a better term, but probably nothing else that would go, oh yes, that's definitely a maternal passing on.
So, and your dad certainly didn't have any?
No.
Sign. Okay.
No.
Because you just wonder, maybe men aren't as affected,
Yeah, no, I don't know. And maybe my grandma and my auntie didn't. It's just when I think about what I have seen of their bodies, which wasn't a lot, but yeah I mean, particularly the thicker legs, that definitely rings true for them. But I don't know how the genetic carry-on part works.
Okay. So I will just interject quickly here. After our discussion, I did look more into the genetics, and it looks like the genetics are pretty complex and poorly understood, but there has been some suggestion it could be autosomal dominant, but with sex limitations. So dad could pass on the gene to his sons, who would then be carriers, but if he gave it to his daughter, then she would be affected. This would fit with Chantel's family history, but it sounds like the genetics aren't fully understood, so we don't really know for sure. But interesting. So you're a registered nurse, and so you've been doing that for quite some time, so you've got this health background. And then what I find very fascinating is that you then marry a doctor, but this diagnosis didn't come about still until I think you said your second child?
Yes.
Okay.
Yeah.
So can you talk a little bit more about how that came to be?
Yes. When someone has lipedema, they have lots of crappy, what do you call it? What's the word? When you have self-esteem days, I guess.
Okay.
And I was just Googling cankles, because that's what people used to describe my legs as, having cankles, which was highly offensive and triggering, but that aside. And so I was Googling what causes cankles. I mean, already knowing a little bit as a nurse, but then the word lipedema was coming up, and pictures in, Google Images of lipedema, and I was like, shivers, they're my legs. I'm just looking at myself here, which was a horrible feeling, but also, it was very bittersweet, because it was like, oh, actually, this is interesting. There's a lot of people who look like me. I didn't know anyone else who looked like me, so this was like crazy for me. And then so this word lipedema kept coming up, and then I just started doing more research, really. Google research, so Google Doctor, highly not recommended, but
in this case it worked.
Well, helpful in the immediate phase. So from there I started getting some medical research papers, trying to pull them out of the abyss to try and understand more, and come across a couple of surgeons from Australia who deal with it, and listen to some podcasts and things. And at this time, Jake, my husband, had never heard about it, so that wasn't helpful. But then I was, trying to collate my case, really. Not that he wasn't supportive, but he was just like, I haven't heard of it. Yeah. I asked him to read some papers. He's not a reader, so that didn't happen. So I said, here, listen to this podcast. There's a surgeon in Sydney who was doing a session on lipedema, and he came out and he goes, yep, that's absolutely what you have. So we went from there.
Okay, so then from there, where did you go?
Well, I said to him, I was like, I'm having surgery. I can't live with it. I have to get rid of it. It's horrific. And he's like, okay, let's do some work first.
Yeah.
And I got in touch with the local service, the Lipoedema service in Berry, just, contacted them and said, hey, do you see Lipoedema patients? Do you know anything about it? And the lady there, Helen, was amazing. And she said, yep, we'll get you an appointment. Come and see me. I'll start giving you some treatment for conservative treatment to help with the symptoms. And that, opened up a new world in many ways. Yeah.
So tell me about that.
Yeah, well, so I was seeing her regularly for manual lymphatic drainage, which is considered one of the key conservative treatments to help manage the symptoms, particularly the pain. It's moving all the fluid that builds up in your tissues, attracts proteins and inflammatory markers, and therefore you get increased pain. So you want to move everything out of the tissues so that you've got less swelling, but it also helps reduce the inflammatory load in the fat cells, so you have less pain. Ultimately. So that's definitely helpful. I always found wearing compression garments, the key difference. Horrible to adjust to, somewhat unsightly, but if you were covering up wearing jeans in the middle of summer, that didn't matter anyway.
Yeah, and that's what you were doing.
And that's what I was doing because you're taught very early to hide your body because it's offensive to people. They don't like seeing abnormally shaped limbs. And then also pneumatic pumping. So I ended up buying my own machine and was doing that multiple times a week as part of my own treatment. And there's dry brushing and things like that, which there's not a lot of evidence to support that really. And your own sort of manual lymphatic drainage that you can do a little bit at home.
And is that kind of a massage type?
Yeah. Okay. Different to, we're not targeting muscle, we're targeting lymph system, which is just under the skin, so it's much lighter. Yeah. And then there's the diet component. So the thing about lipedema is it's traditionally understood to not be, diet and exercise don't help. Yep. Once you've got inflamed fat cells, they stay inflamed. But what you eat can increase the inflammation. So you can't lose the weight, but you can kind of try and reduce the inflammatory load. So some recommend keto diet, some recommend Mediterranean, and you just have to kind of go with what works for you, because what works for someone won't work for someone else.
So is that like a low inflammation diet or something like that?
Yeah.
Okay. And so did you find much benefit from that?
Well, I think with a history of, most people with lipedema have a big history of a dieting world. You try everything to see results and nothing works. So then to be told you now need to start a new diet I hate the word trigger because everyone uses it for everything, but it is triggering because you're like, well, it won't work. I've tried everything before. And truthfully, nothing has worked. So I still struggle to get on board with that. There's things, I'll make changes. I know that alcohol inflames my body. I'm not a big drinker anyway, so that wasn't a big change. And some red meats, I can feel, I feel like I have a heartbeat in my legs. Okay. But just small changes because I can't do the whole thing.
Yeah. We've talked a little bit before we started recording today, and you were, talking about some of the exercise and things that you've done. And, at one point you were doing pretty intense exercise most days of the week. Would that have been, I would imagine it would be quite painful even doing that exercise.
Well, yeah, but it's not even that, because you learn to live with the pain. It's just you're normal. It's like people who have experienced chronic pain. It's just that's your base level. And not that you forget that you've got it, but you just get on with your day. Yeah. So for sure, in hindsight, there were days you bruise more easily. So I'd wake up and go, I don't know how that happened. But it was the inability to do things. Like I could never do box jumps or high knees or mountain climbers and things like that because my legs were so heavy. I physically couldn't move them.
Wow.
As easily as other people. And I've been active my whole life and I struggle. Running is hard work because, carrying extra weight makes it hard. But, and my husband doesn't exercise as much and he'll go for a 5-10K run and it's not a big deal.
Disgusting.
And I hate him for it.
We all do.
But that's some of the things that you grow up, you live with it and you just think that's normal. But in hindsight, you're like, no, actually there is a reason why these things are hard.
So I have read, and I also have a patient currently who is finding that being in the pool has been life-changing. Yeah. Did you do much pool work?
Well, we don't have access to a pool easily. Yeah. No, when you're in the water, it feels amazing because it's it's the only time you don't have weight to lug around.
Yes. And the heated pool, I think, can be quite soothing as well.
Yeah, I mean, I think that's true for everyone, isn't it?
Yeah.
Yeah. But yes, like it, sorry, that.
How rude.
But isn't it? Isn't being in water amazing for everyone?
Well, I think for this particular person, she actually was like kind of mind blown because it was so exercising for her, so painful.
Yes.
It put her off of walking because it's painful.
Yeah.
And then she found this thing and was like, oh my gosh, I want to go and do this because it feels so good.
Yeah. Well, and in the lymphatic world, we would always say to people to swim, like even if you're just walking in the pool, because your body's so supported. But then interestingly, the movement of the water against your body is also a form of manual lymphatic drainage because of the pressure changes with the movement. So there's lots of reasons why it could be beneficial.
Okay, so you went to the lymphedema clinic, you got some treatment, and then at some point you decided, because I think you said initially, I'm going to have this operation.
Yeah.
So then it would take us from when you decided to go from just the conservative management, I suppose, to a surgical management.
The problem with lipedema is it's not recognised yet. Officially in Australia. Yeah. And so surgery is fully self-funded, incredibly expensive, and the wait lists are a lot. So I had my first telehealth consult with a surgeon in Melbourne, and I waited 9 months just for that consult. Wow. And then I waited well over a year to have my first surgery.
So are there only a handful of people who actually do, because it's just liposuction and reconstruction, which you would think that...
It is, but they use it's a different form of liposuction. It's because you've got it should be true for all liposuction that you need to protect the lymphatic system, but that doesn't happen necessarily. It's quite an aggressive technique anyway, if you've ever seen what it looks like.
Yeah.
And the surgeon that I went to in Melbourne is like the leader in Australia in research, and he's transformed the surgical world in with his technique, which is slightly different than a standard liposuction technique. Yeah. Don't ask me more about that. Because he's very popular and so good at what he does, you just have to wait for it. Yeah. And you're happy to do it because you know that it's life-changing. Yeah. But that process of waiting is uncomfortable because you know that there's something that can be done, but you have to wait for it for lots of reasons. So, yeah.
So you shared with me some photos before we started talking, and some significant changes. Did you do measurements or anything like that of your arms and legs before the surgery? Before and after?
Yeah, not me personally, like my therapist did for my manual lymphatic drainage, because you need to be measured up for compression garments. Yeah. And the actual number changes, I couldn't tell you off the top of my head, but
it was significant.
Yeah.
Just even looking at the photos, it would have been significant.
Yeah.
And how did that feel to have a shape to your legs walking?
Well, it still surprises me. Because you're so trained to believe something about your body, you really have to work hard to rewire what the new truth is, if that makes sense.
It absolutely makes sense.
Yeah, and you still fall into old habits of hiding because you don't want to be offensive to people. And so I still... wearing shorts is still a big deal for me. Yeah. Because all through my adult life, I've never worn shorts in public. Wow. Even on 40+ degree days, because I couldn't even look at my legs because they just seem something so foreign to the rest of me. But so there's still a lot of work that has to be done around building confidence around what my new self looks like.
So we know that the diagnosis often is delayed. It shows up in puberty, and it's often delayed until they're 30 or 40 years old. How old were you when you finally kind of worked out the diagnosis? Diagnosed yourself, essentially.
Yeah, basically. Well, I would have been in my mid to late 30s. So 30... How old was I? 37? 30? No, that's not true. Maybe 35, 36.
Okay.
Yeah.
So that's exactly what we're seeing when we look at the literature.
Well, and it makes sense because you have this whole history of presenting and no one knows about the condition really. So you are told, lose weight, exercise more. And you go through that for a while.
I can only imagine. You have touched on different things of how you felt and what you noticed. But if there's someone out there who isn't sure, what they're dealing with, or clinicians who are listening who are like, oh, I don't know much about that, What are some kind of key features that we should be looking for?
Well, obviously it depends on where it's presenting, right? Like, I think it's more commonly recognised in the legs. So you'll have I'm just trying to think of what the word is, cankles.
Yeah.
The word that I hate. Like the cuffing of the ankles, where the feet are not affected. Like, it looks like you're wearing bloomers with a cuff, and then your feet are normal. So that's a real key sign.
And looking at those photos that you showed me, that was really the stark difference between your feet.
Yeah, correct. Yeah, and then also a lot of people have they'll carry a bit of extra weight in the internal knee, like in the inner knee, just below your knee. And look, it's not fluid. Like, it can be over time, but it's just inflamed fat, so it's very, very sensitive to touch. You'll get skin changes once it's more developed. It looks a bit like an orange peel. Just tenderness, heavy. It just feels heavy. You're just lugging around. It feels like kilos, and literally for some it is.
Yeah.
Bruising, you bruise more easily. Just really, really tender. So people can just slightly touch you, and you almost go through the roof. And it's clearly not an appropriate response to what's happened, but that's just how painful it is. Yeah. And then your extremes of the heat usually exacerbate things.
Okay.
Lots of people, myself included, the heat always made it worse because, how fluid pools, and you usually have other issues venous-wise. Yeah, I mean, that's the key things. And others, when it's further developed, will have like lumps that you can actually palpate, kind of feel like peas.
And did you have those?
Yeah. And I still do, because I can't get rid of everything.
Okay.
And the lipomas are really common.
Okay. Oh, that's interesting. So working, we are in a small regional community, and you work in a clinic that sees, both lipedema and lymphedema and probably other things, I would imagine. How often are you seeing this? And are you seeing people who haven't actually had a diagnosis, and you're kind of...
Yeah, lots. Yeah. So lots of people will present... it's not always referred by a GP, but often self-referred as well, because they get to us when they're at the end of the road, nothing else has worked, and they're just like, I don't know, I'll try this. What have you got to offer? Yeah. And you're like, oh, I can clearly see that you have lipedema.
Yeah.
We can help.
Yeah.
Yeah. Or you've got both. Yeah. And for some people, and with myself having the experience of it, it is helpful, because I get it. It sucks. But we can make it better. We can't make it go away, but we can make it better. And that's nice to be part of, because I didn't have that. So that's nice.
That is so awesome to be validated by someone who's been through it.
Yeah.
So lymphedema, lipedema, can you just basically throw out the differences for people?
Lipedema is traditionally always considered bilateral, like both limbs will be affected, whereas lymphedema is often one side, depending on what the cause is. That's not always true. We usually see both sides affected, because we see them not end stage, but like later on, where we've had further deterioration of the lymphatic system. But I mean, that's always classic, 2 legs versus 1. The fluid in lymphedema moves. You can get rid of it, you can get clearance, you can see a reduction. Lipedema, you can't. You can feel lighter, but the fat's still there. Okay. It's still inflamed. Whereas with lymphedema, you can move the fluid, and you'll see, in some people, a really radical reduction in
just
size.
Within one treatment?
Yeah.
Oh, wow. Okay.
Yeah. The pain, lymphedema is not usually painful. Yeah. In fact, and even as it's further progressed to really significant fibrosis, it's not painful. Okay. Lipedema, very sensitive to touch. Yeah. So when I would have a massage, which unfortunately is not very often, I would have to say just light, don't go heavy anywhere. Yeah. So I'd never aim for muscles, because I'd be through the roof. So yeah.
So was a massage even, I guess your back would be good.
Yeah,
your head
yeah.
would be
Well, and I would say that, like, do normal on the back, but you basically just be a feather on my legs. Wow. Because I would be laying there going, oh my gosh, I want this to finish. This is horrible. Say something. Yeah. And then you'd come out and you'd be covered in bruises, because, it's just,
And with the lymphedema, the feet...
correct. So with lymphedema, you'll have the swelling of the feet and the shoes that don't fit, and they start wearing open-toe shoes, because that's the only thing they can have to fit their feet, whereas lipedema, it's not generally affected. unless they have a lymphedema component.
Yeah.
Yeah.
Okay. So if someone's out there and they're thinking, I could have this, what would your advice be like from there?
Oh, it's so hard, right? Because there's not a lot of services, and no one knows about it, but officially it's not recognised.
Let's talk, because you did say that there are other countries who listen to this podcast. You did say there are other countries who are much better at it than we are in Australia.
Yeah.
So they might have easier access.
Yes.
Yeah.
Yeah. And I'm very happy for them.
Good for you.
It's tricky, right? Because if it's not recognised by your health professional, they can't tell you where to go to get help. So it's all very self-driven. Yeah. And if you don't, for me, I have a medical background, so that was helpful. Yeah. For those that don't, you're lost in limbo. Yeah. There are great support groups on like Facebook, Lipoedema Australia. Yeah. Their website is great, and their Facebook page is really good. It's just people who come together to, well, it's not to complain, but you're heard because everyone goes, yep, that's me too. So that's validating. And sometimes as a beginning, that's all you need. Yeah. Just to go, okay, there's a reason that I present like this. Yeah. And that's really important from the get-go. Yeah.
So some support groups online. And then I suppose Googling a lymphedema clinic.
Yeah.
That's more well-known. And
so from a conservative point of view, they'll say key things would be regular manual lymphatic drainage. Yeah. Now, what that looks like is very different between who does it and how you've been trained. Okay. So just be cautious about where you go, because some will say that that's what they do, but they're just doing a nice soft massage. Okay. And interestingly, technique matters.
Okay. So there's a certification, there's education. Yeah. You can look for qualifications.
Yeah. And getting into compression garments it's so unsexy and uncool on many levels, but so helpful. I would just say of all the things I've ever tried, that's the thing that makes me feel the best.
Okay. So there are compression garments, and then there are compression garments. So what are we talking?
I'm not talking about the ones you buy from the pharmacy to hop on a plane and go overseas. Medical grade. However, saying that they need to be measured. You need to be measured to be appropriately sized. Because if you're in the wrong size, you can do more damage. Okay. And I say all that, and that sounds really simple, but if you've got nowhere to go to have that done, that's a really tricky spot to be. But lymphatic clinics who do garmenting, who do manual lymphatic drainage, who do pneumatic pumps, they're the places you want to go, because they'll be the most helpful.
Are there any places, like any online things where they can show you where to measure and you can order that way, or not that you're aware of?
Yeah, I think if you're talking medical grade, they expect you to be measured up by someone who knows what they're doing. Okay. For the simple fact that you can do a lot of damage if you're in the wrong thing. Okay. Yeah, and it's actually technically there's more to it than just wrapping a tape around you. Like there's a science behind it.
Okay. Makes sense.
Yeah, but being in something is better than nothing. Yeah, I wasn't resistive to it to begin with, but I remember the first time I was wearing it, and I just felt this real sense of irritation. And by the end of the day, I was so irritable. I have to get these things off. I just feel that over the sensory input was really, for me, it did take a while for that to settle. Yeah. And then I was like, oh, this is amazing.
Like taking your bra off when
you're taking your bra off at the end of the day. But it's the opposite. It's putting the compression on. You're like, oh, everything's where it should be. Yeah.
Okay. So it wasn't... No, so in the beginning you were annoyed having them on, but then eventually you got to the point where you wanted them on? Is that what you're saying?
I knew the benefit of it, but to begin with, the first couple of times I wore it, just the sensory input was overloading. And once I was able to calm down from that, then I was like, no, it's a good thing. And if I didn't wear them, then I knew about it. Yeah. So it's a bit bittersweet because it's an extra layer in the heat. It's hot, but there's lots of different types. So that's why it's a good thing to be hooked into someone who can help you with what you need.
Yeah. So if we're talking to someone who doesn't, they don't seem to have those places around, or maybe they don't have the resources, even just wearing some like compression, what do you call them? Like 2 times you workout pants.
Yeah. Or what? Well, so interestingly, I tried to wear them, but I couldn't get them on. They just wouldn't fit. Okay. Because of my shape. So that's the other thing that will be an issue for people, and hence why, and I know I keep coming back to being measured up, but we can custom measure, and therefore it'll fit your shape and be the appropriate pressure.
Yeah.
Yeah. So, I mean, definitely for some, if that's the only option, wearing some form of compression leggings is better than nothing.
Okay. Let's go back, because you said something, if you're treated early. So what are the benefits of actually getting diagnosed and getting this treated, let's say in your 20s or even late teens?
Well, you're going to stop the progression, right? Like you can't get rid of it.
Yeah.
But you can keep your inflammation, your load lower, so that it won't develop into
the nodules and the
yeah.
And so is that the lymphatic drainage and the compression and the inflammatory diet? Or, before you've tried all the other diets for the sake of dieting. Yeah, okay.
Don't say the word.
I get it. I know. I hate the word diet too. Okay, well, is there anything that we haven't touched on that you think is important that you would want people to know? I think, we talked about before the discussion, my goals, my intentions were that if there are women out there who've not had a diagnosis, that this empowers them to help get the help that they need to, or, the information they need to get a formal diagnosis and get the treatment. And then the second thing was for those people who are busy judging people for their cankles. One, don't use that word. I've never used that word. That's just so rude. And to let them know that this, you might be looking at someone who it's not going to fix it just to lose some weight.
No.
So those were kind of my intentions. But was there anything that we haven't talked about that you wanted to touch on?
Well, if I was asked what would have been useful for me.
Yes.
Many years ago, and I'll probably get emotional, I can already feel it, but it's that the validation that it's not your fault.
Yeah.
You can't control what your body is doing despite what you're doing.
Yeah.
And it's incredibly frustrating beyond any words, but it's not your fault.
Yeah.
And that, for me, that would have been helpful, because I could have had a more love and appreciation for my body a lot earlier for what it could do and make adjustments to accommodate what it finds difficult to do. Yeah. And if I'd known about it earlier and was able to action things earlier, I wouldn't have progressed to the level that I did. I'm grateful that I have been able to be diagnosed and have treatment, because that's not an option for a lot of people. And it's changed my life in so many ways. So for me, I would go and have my 6 surgeries all at once tomorrow if it meant that I was going to live the life that I was able to live now.
Yeah.
So it's definitely worth looking into, at least. And you will come against people who won't believe it, because officially it doesn't exist. And that's also really difficult, because you have this experience. You live this life that's in many ways horrible, and you get no validation from it, because people don't recognise it as a condition. It's just you're fat and lazy. So you're up against that attitude, which is incredibly unfair and so unkind. And people, I don't know, it's horrible. It's a horrible condition, and it would be lovely at least for it to be officially recognised.
Absolutely, yeah.
One day.
Yeah. One day. And it would be amazing if these treatments can be at least partially covered by Medicare at some stage.
And I think the other thing is once you learn about it, it is so overwhelming, because you're validated, but then you're up against all the challenges around not having access, having to pay for everything yourself. And that becomes a whole new level of challenge. But then just to say, you just make small changes at once. You can't do everything. You can only do what you can do. When you realise that helps, you keep doing that and then start doing the next thing. Yeah. Otherwise, it's too overwhelming.
That's always my philosophy. One small thing at a time.
Yeah.
Do the private health insurance, do they cover anything at all?
So for my hospitalisations, they covered that, because before you have, at least in my experience, before I was able to have surgery, I had to have the test where they inject the dye into your feet. I can't think of what the fancy word is right now, but then they assess if you've got the leakage into your lymphatic system. And if you do, then you've got a lipolymph, and then you'll get more coverage because the lymphedema's recognised. And fortunately, I have a mild element of lymphedema as well. So that's It's helpful from
Yay!
it's helpful from a code, what do you call it, like your Medicare numbers and stuff, which is all ultimately bullshit. That's what you have to do for you to have a level of recognition. But yeah.
So then I guess looking at those compression stockings, I know that for lymphedema you can go into a scheme and have some of that covered. I'm not sure how much of that, but no. Okay.
So, and that's the tricky thing. It's an expensive condition because it's not recognised, so everything's out of pocket. So it's one thing to have a diagnosis, but it's another to be able to afford to buy back your health.
Yeah.
And that's not fair.
Yeah.
And the garment scheme is awesome for those that have the lymphedema. If you're lucky enough, if you're unlucky enough to have both, then you probably can get coverage because you've got the lymphedema component. But it's tricky in many ways.
Yeah.
I think the lack of validation is the worst part though, because you know something's wrong and you're basically gaslit because you're just told you're fat and lazy and you're like, oh, no, I know that's not the case. Yeah. And then you've just got that judgment of everyone else. So you hide your body, which is also
very sad.
Yeah.
Well, on behalf of all medical practitioners that you have dealt with over your whole life, I am sorry. And I'm sorry for all the ones that I have misdiagnosed as well. So that's what this is about, is bringing awareness so that more women don't suffer as much as you have. Yeah. So thank you so much for taking the time to come out here and hang out in the sunroom, which isn't so sunny today.
It was before.
Yeah, it's gone now. I really appreciate your time and the time that you've taken to be here today. So
Not a problem. Thanks for having me.
You're so welcome. So that's what I've got for you today, guys. I hope that you got something out of that. Chantel was incredibly brave, courageous, coming on and giving her story. I am so appreciative of the time that she took to spend with us, and I really hope it helps someone out there get the diagnosis and the treatment, the help that they need to help manage the condition. And I hope that maybe that gives you some resources to look for, or a place to start to help getting some treatment, and maybe some validation, and maybe some awareness for those who are sitting in judgment and maybe thinking twice before passing that judgment. In any event, with or without lipedema. I hope you all have an amazing week, and until then, I hope you opt to thrive. Hey, before you go, if you're a midlife woman who wants to feel better in your body, whether that means improving your health, building strength and confidence, or working towards weight change in a kinder, more sustainable way, I have created something especially for you to support you. It's called the Midlife Health and Body Reset Kickstart Guide, and it's a free 7-day foundations guide to help you understand what's going on in your body in midlife and what actually makes a difference from here. You can download it using the link in the show notes. And if you're ready to take that work to the next step and you would like some personalized support to make it work, I run a 12-week midlife reset program where we work together on body recomposition, so losing body fat while regaining muscle, the absolute best thing we can be doing in midlife to combat midlife metabolic convergence. You get a custom strength training program from an exercise physiologist, weekly coaching with me, personalized nutrition guidance, and accountability to help you actually follow through. If that sounds like what you need, head on over to optothrive.com to find out more about the program, and maybe even book a call with me to ask me any questions that you have, see if we're a good fit, and see if this program's for you.
The Opt to Thrive podcast is designed for information purposes only and is not engaged in the giving of medical advice. The information provided on the podcast should not be used for diagnosing or treating a health problem or disease. In no way should the information provided by Opt to Thrive be considered medical advice, and at all times the advice of a medical professional should supersede recommendations from Opt to Thrive. If you have or suspect you may have a health problem, you should consult your healthcare provider. The views expressed in this podcast are purely that of Dr. Sims and do not in any way reflect those of the institutions she contracts her medical services to.
Thank you for listening to Opt to Thrive. If you've enjoyed listening, please rate and share the podcast. You can visit our website at optothrive.com and leave a comment for any subjects you would like to hear more about.